Walter. I'm the lead pastor at Heritage Church in Sterling Heights, Michigan, and it's my privilege to welcome you to another episode of A Doctor's in the House. The purpose of our show is to provide a local perspective on the coronavirus pandemic from medical experts and scientists and community leaders, and so we're glad that you're able to join us today. If you're watching on Facebook or YouTube during the live broadcast, you can send your questions in using the comments section, and we'll try to get to as many of those at the end of the program as we possibly can. I want to welcome Dr. Bisham Singh. He's a co-host today, and I want to thank you for taking time with us today, Dr. Bisham.
Thank you. It's good to be here.
Dr. Singh's background, for those of you that are new to our webcast, he's an administrative fellow with the DMC and has worked tirelessly to improve healthcare here in the States and globally through his global health organization. We also have with us Dr. Edwin Huffine, and he's a world-renowned scientist. And Dr. Singh, let me have you introduce Dr. Huffine.
It's my pleasure. Professor Huffine is a dear friend of ours, and he's really world-renowned. He's been he did the forensics for the Bosnian genocide. He's worked with the UN. His credentials are the size of an encyclopedia. So I'll spare you a lot of that. You could probably Google his name and find a lot of information. His work is so revolutionary that his group has been nominated for the Nobel Peace Prize for 2020. And he continues to be a good friend. We were just in the White House for an event about 2 weeks ago, and the coronavirus has been on the focus for us for a long time. Ed and I have been working on several projects to help, and we'll unfold that as we discuss this conversation. With that, I'd like to introduce you to Professor Huffine. Ed, would you like to tell a little bit about yourself?
Thank you very much, Doctor. It's both a pleasure and honor to be on the program. Just a little bit about myself. I realized this morning I've been in forensic DNA for 30 years now, and I don't know if I want to admit that or not. I opened the Federal Aviation Administration's DNA laboratory beginning in 1990. I then went and headed the U.S. Armed Forces DNA laboratory that identified missing soldiers from Vietnam, Korea, World War II. From there, I went to Bosnia. And that's the first time that DNA was used on a mass scale to identify victims of genocide. The lessons learned in Bosnia have then been used around the world to develop similar systems. And after Bosnia, I've traveled the world. I've been to 83 countries, lived in 6, helped more than 60 countries develop forensic systems. And during this time, I came to know quite a few people in the governments of these various countries. And I'm now helping not only do forensics and DNA work, but also help these countries develop trade amongst each other, especially with the United States. That helps create jobs. It helps create common understanding between different cultures. It helps a way to transfer technology when you feel that you can identify persons better, faster, more effectively. This is one of the reasons for the missing persons part, the Nobel Peace Prize nomination for the Argentinian forensic team. They have been involved in the recovery of missing throughout Latin America and other places in the world for over a decade, and I brought the DNA component to them. So they've identified thousands of people from the 1970s dirty war in Argentina. It's just one example. So their work and the impact it's having on society is the reason for the 2020 nomination for the Nobel Peace Prize.
Thank you, Ed.
Well, what a great honor, and it's our privilege to have you on the show today. We have a couple of questions, even as people are beginning to send their questions in online. But we do have a couple questions to kind of get things started, and I'm always curious whenever we have a couple of doctors on the show. I'd love to ask you, what are you telling your family about COVID-19? We'll start with you, Dr. Singh.
Well, today was an interesting day. Of all the days of confinement, today was ground one, like day one, where my kids started their online schooling. So everybody's at 9 o'clock today. They're all signing in. It was kind of interesting, just like how we have this program. Their screens on their computer has all their classmates and the teachers doing their presentation. My wife's actually a physician, so she's actually doing. She's a family practitioner, so she's doing a telemedicine component to her practice. What we are telling them is obviously they're fully aware of what's going on. They're fully aware that this is serious. This is the first time the world world has ever encountered something of this nature where we're confined in a group setting, meaning globally. And the fact that washing hands, keeping yourself always, looking out for following the rules that the CDC and the government's put out, and we discussed those rules and why it was important. The most important was isolation, even when you're speaking with neighbors, making sure that you keep your distance, regular following, things like that.
Right. Do you have anything to add, Dr. Huffine?
Oh, yes, I'll continue to hit the high points of this. A lot of it is being confined. Something about our particular household that is similar to some other Americans that may be unique to them also. We returned from the D.C. area to Oklahoma to help care for aging parents. So my mother turns 95 this year. My mother and father-in-law are in their upper 70s, and my father-in-law is on dialysis. So we make sure they stay home. I go out and get whatever supplies they need. And obviously, since my father-in-law always has to go to dialysis 3 times a week, you have to make sure they have extra care. You always wash your hands. When I'm out shopping, I wash my hands before I leave the store, wear gloves, still wash, and then when I get home, I wash. So we just have to be very cognizant of what we do. Staying home is a huge alteration in behavior, but there are other smaller alterations, just for instance, the way you even cough. And just always keep track of each other. How are people feeling? I'm in daily communication with my mother and my in-laws just to make sure how they're doing, if they need anything. Do they need to go to the store to get something? Do they need some medicine picked up? So limit the number of people that leave. That limits the number of exposure. If there are 2 of you out in the store simultaneously, that doubles the chance that someone is going to come in contact with something. So find someone who is most effective, who is able to go out and get these things done, and then we just stay in isolation until this passes.
Well, thank you. One of the reasons why we're excited about this episode in particular is because of this next question and the fact that you guys are finding answers. It's amazing that you guys are able to team up on this. Here's the question. What's being done about masks and protective equipment for our healthcare professionals? We're hearing from all around the country, and even here in our state, our governor and even many of the local health professionals and first responders are saying, we just don't have enough supplies. And so I'm excited about this next question because I know what your answer is already. But what's being done about masks and protective equipment for our healthcare professionals?
Well, Ed and I we're working on several projects. In the past episodes, we talked about doing medical systems in Africa, introducing our American model, which is the best model abroad. But once we knew this was coming to our mainland. We actually were studying the data and we were discussing this. Once it arrived, this shortage of masks gear, we dropped everything. We pretty much, we're all having our normal lives, and we stopped to help. If we can't start at home, where can we start? And we realized, governors and politicians and president, everybody trying to find resources to address this issue. So Ed and I, for the last 2 weeks, maybe a week and 2 weeks now, right, Ed? That we've been trying to find supplies, looking at where we can get these things and real quality. There's a lot of fraudulent stuff. I'll let Ed talk to you about that a little later. And so verifying what we can, what the N95 masks are, what the gowns are, what our protective gears are, to bring to the American, to our healthcare professionals and to the American public. And so we've now narrowed it down. We've got resources where we can get those masks, we can get those gloves. We can get even the respiratory machines, as Ed would tell you, we can get those now, and we're available to start helping the public. Ed, would you like to add to that?
Yes, thank you. Something I mentioned earlier is I've been to 83 countries, and I've met so many people throughout these countries over the last 30 years. You develop trusted relationships with people in these other countries. And because of that, I'm able to reach out, and we're able to reach out across the globe to ask, are there any supplies of these materials, or are there production centers in your countries that produce certified products that are reliable, and you have great trust in the character of the people who work there and the management? We're getting responses back. There are between 3 to 5 million face masks that meet the qualifications needed that can be sent here in a relatively short time frame. I also reached out to contacts I have in Saudi Arabia who are very good friends and contacts. They said the Saudis responded, we will do what we can to help America in her need right now. So they are also looking out to see what can be done to assist the United States. It's these type of relationships that have developed over decades that have a great value in responding to emergencies like this because people know you, you've developed the trusted relationships. They're able to go the extra mile to not only find materials, but to personally verify their quality, their authenticity, and that all the certifications are in order. And that's what we've been able to do over the last couple of weeks, of find these various, number one, supplies that exist. And secondly, we're able to contact the production center. So if we want to order 25,000 masks per week, we can have a regular shipment of masks coming. So we're looking at one big upfront shipments potentially, as well as recurring shipments. So these are ready, they're ready to go. And we've been able to identify how to meet some of the key needs in the United States.
One of the things that I see as an opportunity for our viewers is maybe to partner this way. So one of the things we're going to do by the end of the day today, I just found out about this opportunity, or we'd already have it done, but by the end of the day today, we'll have a link on our website at heritagechurch.com where you can specifically give just to be able to buy masks for our health professionals here in Michigan. And we'll have the cost per mask, and we want to invite you to participate. We're also reaching out to a lot of our pastor friends and our organizational leader friends around the country, particularly here in Michigan, to help bring as many of those masks and protective gear to our region as possible. So, and we'll be able to work through you and you guys. You know, there's so many people making claims out there. You never know who to really trust. But when it comes to the two of you guys, I do trust that. And so we're willing to try to make that work. I think it'd be a great opportunity. One, for Christians, for Americans in general, we're always best when we run at solving a problem rather than just hiding from the problem. And so it's easy to sit on the couch and just watch TV and to get sucked into those things and to be afraid. But when we have an opportunity to serve those that are trying to serve our people and to serve our families and all that, that gives us something to focus on, to do good. And there's a lot of health benefits, actually, in doing good deeds. Dr. Singh, you mentioned that to me the other day, that you've done a little bit of research. We don't have to get too technical on it, but there are a lot of health benefits with regard to doing good to help other people. Do you have a comment on that?
Well, you know, there's a lot out there that for altruistic behavior, they seem to be not only boost the good dopamine, the good receptors, good hormones in the body, but you're actually feeling well. It actually, to be honest with you, slightly you feel that you're healthier, your immune systems are better. You're doing something good versus, you know, being clandestine and hiding. Get out there, do some good. Keep active, obviously, keep fit and keep healthy. But to add another component to what Ed was talking about, not only the mask, we have the testing kits. We have access to the legitimate and really good testing kits that are available. And so we've been vetting these things for a while. Ed and I, you know, at times have been up to 1 a.m. trying to make sure that we're connecting and to make sure these are accurate tests. But we have access to that as well. And I see that the United States is moving forward to a rapid test. I'm going to ask Ed to talk about those tests, Pastor Jeff, if you don't mind, and some of those tests, what it does and what are these tests, how is it being done, and how rapid are they in the different various tests? Ed?
Yeah, sure. There are two main varieties of tests out there. One is very recent and got FDA approval just last week. But the two type of tests, the first test is the standard. You take a sample, you take it into a laboratory setting, you have sophisticated equipment, and you have scientists who operate that equipment, and you get results within several hours to a day. It's called a PCR-based test. It is more laborious. It takes trained experts to do it. It takes trained experts to analyze and interpret the data. The other kit that's just been FDA approved is something that's far faster. It's basically you do a finger prick, you take a sample of blood, you put it on this very small handheld device, and it will give you a positive or negative result within 5 minutes. So that fundamentally changes the ability to do testing, because now people could actually go through a drive-through, have a sample taken, and wait for results in real time, basically. Well, if you're able to identify people who have the virus, test positive very quickly, you're able to go to a different level of quarantine for them. Now they know they're positive. So there's no longer, well, maybe I am, maybe I am not. I'm going ahead and go outside. If you know that you are positive, you can also then have your family members tested. So that adds a new level of testing abilities to us that is so much faster. So it speeds up the ability to detect the virus. And we've seen in places like South Korea, early detection and isolation are very important in retarding, slowing, and ideally stopping this virus from spreading. So we now have these new abilities. It's time to begin applying them.
And so, Dr. Huffine, you're saying that that new test was just recently approved by the FDA. What is the rollout time going to be on that? Do you know?
There are, right now, Dr. Singh and I have access to 50,000 kits. Now, the company who's making these are currently making 10,000 per day. That's going to be increasing. Now, as FDA approval, there are going to be other companies beginning to produce this. One of the great things about America, when there's a problem, we come up with a solution and we mass produce a solution.
Right.
So while we are in a critical, acute shortage right now, a month from now, that'll be different. But how much can this disease spread between now and a month from now? So that's why we're trying to get these supplies to the people who need them now. Then American industry is going to catch up and be able to fulfill all the needs within a 1 or 2 month time period.
Wow.
So another thing that Professor Huffine and I were talking about, and he's done this in different regions, but for different, obviously different metrics, different pathologies. We have the ability to actually, we're talking about these drive-throughs and take the pressure off the hospitals, so people are not rushing the ERs to get tested. So obviously, without showing, obviously, if you have signs and symptoms of the coronavirus, that your healthcare professional is the way to go. But we're looking at seeing if we can connect with the state to have these drive-through testing kits professionally done, where you don't have to leave the car. You basically can get tested with these kits that Professor Huffine is talking about. Get a response, even if they're like law enforcement. I know some of the law enforcement groups are doing it. Firemen, just the day-to-day responders, daily responders, first-line responders for things, and for the public. So we were able to do this. Professor Huffine, would you like to discuss that a little bit more? What are the procedures for that?
Yes, thank you. Some idea we were discussing is we know early detection is a critical component to this. We know hospitals are being overwhelmed right now. Is there a solution to this? And this is one of the solutions. You could set up a mobile tent facility, maybe in the parking lot of the hospital or somewhere adjacent to these areas, and modify it so it can be a drive-through. So people can come up in the car, have a sample taken and tested, basically without having to get their car. So that still minimizes their exposure. It gets the test done. It alleviates not only the demand on the staff of the hospital, but also the supplies of the hospital. And in addition to firemen and police officers, there are mass disaster responders in the United States that might be able to do this. Universities are shut down. Could medical students become part of this from universities? So we have the manpower out there. We have the idea, the concept of how to do it. We have materials available. It's now possible to put all of these together so that we have a comprehensive solution.
That's right.
That's fantastic. I'm very excited about that, and I hope that we can get the contacts. I know phone calls have already been into the governor's office, and others. We're working on that as well. Hopefully we can get some of these things moving as quickly as possible, get into the hands of our first responders, and clearly having a very quick test that is not necessary to make somebody cough every time they take the test will help really protect those frontline people. So I'm very excited about that idea. If you don't mind, can we jump into a couple of the questions that are popping in? One of them we dealt with in our previous episode, but I'm just going to go ahead and pitch it to you, Dr. Singh. The first question says, for parents at home trying to protect their kids, what are some suggestions for helping boost their immune system, specifically any vitamins or anything? And I know we dealt with that before, and if you could give us the vitamins that you guys are recommending to boost our immune system, and then also maybe some of the amounts, because I'm not sure we covered that in the last episode.
So last episode we had Dr. Nelson on the show, and he discussed those vitamins. So I'm going to repeat some of the recommendations, of course, some of the FDA requirements. So vitamin C, 500 milligrams. I think on my website, I will have Dr. Nelson's recommendation put out there, so you're able to go on it. And Heritage Church will have it as well. So vitamin C, zinc. He talked about selenium to help with the lungs, and vitamin D as well. So these vitamins, sorry, it was vitamin D for the lungs, vitamin C, zinc, selenium, and vitamin D. And of course, fresh fruits and vegetables and eating a well-balanced meal will help. Regular exercise, regular things that will boost your immune system for any other health conditions like other viruses. So you want to make sure you're healthy. That's for sure. And that's the most important. A healthy person is a healthy immune system. So work on those things.
So just to review then, vitamin C and vitamin D, and then
Right.
selenium and zinc. And you said that you'll have the dosages on your website at drbishopsingh.com?
Right.
Okay.
Dr. Nelson sent me his little sheet, and I'll send it to you, and I'll send it to myself.
Okay, very good.
I'll be there on my website.
And those four things, Dr. Nelson said, will just really rev up your immune system. So that doesn't make you foolproof or totally protected from COVID-19, but it does set your body up to be able to fight as hard as it possibly can. So that's a good one. Here's another question. It said, I heard of someone who had a symptom of coronavirus where they lost their sense of smell. Is that truly a symptom of coronavirus?
From what we've, like I said, it is a wide range. It depends on the age group. We've actually heard that that's actually a first lost the taste, lost the smell. Could be an early sign of it from the research we are looking at and the data we're looking at, correct.
Good.
But that doesn't mean it happens to everyone. So again, if you feel like you have this virus or you have the signs and symptoms of this disease, I still go back to the fact that to call your healthcare professional, let them know that's your first line, because they know your medical records, they know what is required and day to day, so they can apply that based on you. So whatever you're seeing on TV, whatever you're watching, yeah, these are helpful hints, but the main person are your healthcare providers. And if I can just add one more thing too, when we're just talking about the vitamins, those are not cure, and you mentioned that it is keep you healthy.
Right.
The cure is actually the vaccine, and we're still waiting for that.
Right. So, Dr. Huffine, here's a couple questions, and I brought this up before the show. Will warm weather stop this? Because that's what some people are saying, is they're hoping that maybe this coronavirus will be stopped by warm weather.
That's the theory, but this is still unproven theory. Right now, we're hoping that this will be more seasonal, just like the flu is. And as warmer weather approaches and spreads through the nation, that the incidence and exposure to this particular virus will decrease. I would suggest we look at places that have warm weather right now. Some places along the equator, potentially Australia, which is leaving their warm weather now, heading toward the cooler weather. But are there any indications of the places where warm weather has delayed or prevented the onset of the virus? Unfortunately, some of these countries along the equator don't have testing kits. So people may be sick, but they may not know they have the particular virus. So that adds another unknown to this. So what we need are communities that are in the warm weather area that have been able to do tests to see what's their incident, what is their rate of spreading compared to what we're witnessing here in the US.
Okay, and so the jury's kind of out on that question. Then we'll have to just keep watching. Here's the last question that I have right now, and that is, what about getting it through food? Am I in danger going and buying produce at the grocery store or buying a hamburger at the drive-thru? Am I in danger getting the coronavirus from the food itself?
I would defer to Dr. Singh on this one.
Well, again, like Professor Huffine said, the data is still new on all this. Last 2-3 weeks, we're receiving data faster, but not enough. From research that I'm looking at and data that I'm looking at, we've studied this virus and on surfaces and what it can live. And go on the website, you can actually see at our website various surfaces and how long the virus can live. Right now, unless the server is actually really contagious, which I don't think they're going to be at the supermarket or the fast food restaurant serving that. But let's pick an example that it is. Of course, the wrappers. So they recommend still hand washing, removing the wrapping, and following guidelines that still would be making sure you wash your hands and do proper food handling. At the end of the game, heat does inactivate this virus. So they're saying that unless you touch your mouth or your face, you still can't get it. But you've got to make sure you still follow the hygienic rules. And again, it's outlined in the CDC's guidelines. And so I won't think I'd be fully alarmed on that, but I think we're still out for the data on that.
And then we had one more question that just came in, and it said, are you saying that every person at some point should be tested for this? Dr. Huffine, maybe that'd be a good one for you.
Unless someone is displaying symptoms, I think it's up to personal choice.
I agree.
I think part of this is awareness. There needs, with anything that's an emergency, anything that's emergent like this, education is important to have. Obviously, if someone is displaying an illness and going around and intentionally trying to spread what they have, that's different. But if it's a person who's at home who is self-quarantined, I would not advocate forcing them to take a test. But at the same time, we all need to be aware and wise. Our actions impact not only us, our actions impact everyone around us and everyone we come in contact with, and then who they come in contact with.
Right.
So as this goes on, if you're displaying symptoms of illness, just like Dr. Singh said earlier, call your primary health care provider, talk to them, see what they're recommending. Just because we're in isolation physically doesn't mean we have to be in isolation communication-wise. So always involve people, your healthcare provider, when you're not feeling ill, when you are feeling ill and you believe you may have the virus.
Okay, so to summarize your answer, you're saying that to this point, probably there's no need to go get a test right now if you're not exhibiting some of the symptoms. But if you are exhibiting the symptoms, get a test as soon as you can.
Call your healthcare provider.
That's
and
right.
see if they can release the test. Right now, there is a critical shortage of tests in the United States. So those tests need to be reserved for those who are manifesting symptoms under the direction of the healthcare provider. In the future, that will change. But right now, we have a critical shortage of key components.
Very good. Well, thank you so much. So I have one last question for you as we're getting ready to wrap up, and that is, what did we not talk about that you think is important that people need to know before we go? Dr. Huffine?
I alluded to it a little bit earlier. This is something that American industry, American free enterprise, American people are going to solve. This will resolve itself because we're going to work together. We are caught in a very critical 1 or 2 month period right now before American industry truly revs up, before our scientific community deciphers this virus and gives us a better understanding. But we've been instructed right now, given the knowledge we have, what our actions should be. And that is basically to shelter in place, to be very cautious when you go outside, to always wash your hands, always keep clean, not to spread the virus. So we understand what to do right now. In a few months, this will be a completely different situation as America herself has awoken to this and is addressing it.
Well, thank you so much. Dr. Singh is also running for U.S. House of Representatives for the 10th District. So just very quickly, I'm not endorsing Dr. Singh, but I did want you to give an opportunity to mention your website and to talk about your zone. I think your zone is from Hall Road all the way to Port Austin or something like that. Why don't you talk about that very quickly?
Right in the thumb, it's District 10. And so that encompasses those regions, Macomb, Chesterfield, Port Huron, Sinilac, and so St. Clair. It's actually quite a big area. But my website is drbishamsingh.com. Please go on there, look at the site. There's a lot of information on there on the coronavirus and how to handle it. Information from the White House on how to handle this, and from the state, the CDC. So please go on there. It's actually a very useful site at this moment for that. And my closing remark is that it's very similar to what Dr. Huffine says. We will rise above this. It is a time that most Americans are in fear, and we should not do not be fearful. We will rise above this. We will get better. We will improve. And in the meantime, we'll be better for this. Stay healthy and take care of each other.
Good. So today we heard from a scientist and a politician and a pastor, and I was just struck by the fact that sounds like the beginning of a joke.
I don't like that word politician. I'm not a politician. I've never been a politician. I'm a physician coming out there. There's a time and a need for us to come out there and to help, and this is the time. So please get that straight.
Okay. It almost sounded like the beginning of a joke, actually, that we walked into so anyways, all three of us work as humanitarians to make the world a better place here at home and around the world, and we want to leverage our influence and our platforms to encourage you to do the same. And I'm particularly excited about Dr. Huffine and Dr. Singh's opportunities to be able to get more of the protective equipment that we need for our frontline people. So this is not a religious issue or a secular issue. I say this every time. This is just a humanity issue. This is a good neighbor issue. And we have an opportunity, maybe you and me, to be able to contribute to this. And so on our website at heritagechurch.com, there'll be the opportunity that you can donate to be able to help us acquire as many masks as possible over the next week. We'll probably shut that donation down maybe on Friday or Sunday. But we want to gain as much as we can to be able to help as many of the local servants that are serving your families and mine as quickly as possible. So there's a Get Help button on our website if you need help. You need food, you need somebody to shop for you, you need somebody to go pick up your prescriptions. We have a team that's willing to help you. And then the other button is to give help. You can make donations, as I mentioned. You can also donate goods, canned goods and non-perishables that we'd be able to help the people in need in our community. So let me encourage you, like us on social media, share this episode with your friends, go back and watch the previous episodes, and then tune in on Wednesday as we continue to get some clear thinking and great advice from local leaders. Dr. Bishop Singh will be back with us. And then we also have a certified trainer and health expert. His name is Chris May. He owns several gyms here in the area, and he's going to be offering tips on how to stay active, how to avoid the quarantine 15, because if we keep sitting around on the couch, we're all going to put on about 15 pounds. So he has some great ideas on that. He's going to offer some easy workouts to get your kids off the couch and some easy workouts for the seniors to be able to start stretching and maybe build a little bit of strength during this time. So as we're finishing up, let me leave you with this blessing from Numbers chapter 6, verses 24 through 26. Moses just simply said, "May the Lord bless you and keep you. May the Lord make his face shine on you and be gracious to you. May the Lord turn his face toward you and give you peace." So I just want to encourage you to stay safe, to live wisely, and to love your family during these crazy times. And thank you for watching Doctors in the House. We'll see you next time.